the masks, the hand sanitizer, the anxiety. They're all starting to slowly disappear as people return to a pre-2020 lifestyle. But is the pandemic really over? On this episode of the Oxford Sparks Big Questions podcast, we're asking, how does a pandemic end? Hello, I'm Emily Elias, and this is the show where we seek out the brightest minds at the University of Oxford and we ask them the big questions. And for this episode, we found a researcher with an eye on the past to help us understand the present.
So my name is Erica Charters, and I'm a professor of history, and I work specifically on the history of disease. So I'm professor of the history of medicine at the University of Oxford.
And so you've been working on looking at the ending of a pandemic. I mean, how do you even start looking at how a pandemic ends?
So this question came up, I guess, early on in COVID. I've been researching disease, the history of disease, and how societies respond to disease for most of my academic career. And somewhere late in 2020, another historian I was working with asked, what would be really interesting to think about is how do epidemics end? We talk a lot about how they start. We talk a lot about what happens in the middle of them, but I don't actually know how they end. And the more people I started talking to, the more I realized that it's true that there's very little research done on the end of a pandemic or the end of an epidemic. And so I started gathering together a number of researchers, and not just historians, all types of researchers, so biologists, ecologists, mathematical modelers, and started a project called How Epidemics End to try to gather the research and also to think about how different disciplines, different researchers measure and define the end of an epidemic, and not just thinking about the course of an epidemic or the climax of an epidemic.
It's interesting you say that, because 2 years ago, there was like a solid moment. There was a press conference assembled. Dr. Ted Ross from the WHO took center stage, and he was like, guys, there's a pando.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic. We have rung the alarm bell loud and clear.
And now it kind of feels like there's going to be some sort of like magic moment where all of a sudden the WHO pops up and goes, okay, guys, it's over. Will we get that?
So I think we'd love that. I think a lot of us would really like someone to tell us, just like we heard at the start, someone to tell us that it will be over. What we found in the research is, of course, in some ways that kind of opening declaration suggests that there's a very clear start. The end process actually is very messy. So it's true that we might get some kind of declaration saying, maybe now we have a number of multiple epidemics instead of one big pandemic. But when you look through the historical record and when you look at other diseases, what we see is actually there's not really a definite end. What I've found in the research is it's more helpful to think about multiple endings, so different types of endings, and also different endings happening in different parts of the world. So there's not going to be, unfortunately, one decisive moment when we can say, all right, now the pandemic is over.
So what have we seen in the past with other diseases and other pandemics coming to an end?
One of the major points of the research project is to try to distinguish between the end of an epidemic and the end of disease. When we talk about an epidemic ending, that's not actually the same thing as saying there's no more disease. So what we see in the past is even, say, with the great outbreaks of plague, say the Black Death, governments will say, okay, the epidemic is over. Very often what you see is governments opening up the city gates, resuming international trade, people being able to move around. But there's still actually a few cases of plague. We also see that in cholera outbreaks, the same thing. What really we're looking for is a decline in the incidence of disease. And partly that's because we might want to remember that in between epidemics is not a total lack of disease. In fact, we're often living with all sorts of different kinds of diseases. It's just that an epidemic in some ways is when there's a crisis, when we decide that the rates of disease that we're living with are such a serious problem that we need to tackle it and do something with it. So this is why when we talk about the end of an epidemic, we're not looking for a case when disease has completely disappeared. Instead, we're thinking about when has disease reached what we might think of as being a tolerable level or an acceptable level of disease.
So where are we at with this pandemic? What would an acceptable level of disease look like with COVID-19?
So with new diseases, this ends up being a really, you could say, contentious and really debated question because we don't have a level of disease to go back to. Very often, if you look at, say, the history of plague, so there were constant outbreaks of plague for years and years in the Middle Ages. And so people could kind of see that there were waves of plague. Sometimes there were waves of cholera in the 19th century. COVID is an interesting case because it's a new disease. So there's a real question here about what do we think is a tolerable level of COVID to live with? And what I found as a historian and what you can see with all sorts of other cases is that ends up being something that society in some ways decides. So this is the other part of the project, is as well as talking about a medical ending to an epidemic. That is when we say the disease reaches a certain level that medically perhaps we think is acceptable. We also want to think about how an epidemic is political and it's also social. So what does society think is a tolerable level of disease? What do politicians think in terms of when do they think it's sufficient for us to remove regulation? So I think the frustrating, some of the frustrating findings in the project for many of us living through COVID right now is that there isn't one answer, and there's certainly not a secret number that's going to help us come to that answer. Instead, the end process is very messy precisely because we all have different definitions of what we might think are acceptable levels, not only of disease, but acceptable levels of political and public health regulations. And we can also think about the social disruption that an epidemic brings. So there's not only a biological end or a medical end to an epidemic, there's also a political end and a social end. And what we found in the research is those ends are related, they might overlap, but they're not the same. And so that's why what we're living through right now is part of that process of debates and disagreements, as well as negotiations with different parts of society.
What's your read then for the UK? What's the vibe like? Are we at a political ending, medical ending, a social ending? Where do we fit into this sort of jigsaw puzzle?
One thing to think about endings is we found that epidemics end at different times in different places. And that doesn't just mean geographically. We can think about how different parts of the world are experiencing different types of ending right now, as well as experiencing different rates of COVID. But also we can see that there's different endings even within one society. So within just England, we might have different groups that are responding differently. And even within friend circles or even within our family, there's going to be some people who feel that COVID in terms of the epidemic is long over, and so they don't want any restrictions. Someone else who feels very strongly that actually restrictions should still be in place and they don't want to go out and they want to maintain a lot of those regulations. So this is why the end process is so messy, because we can think about how everyone is here negotiating their different definition of an ending. We don't often agree on these points, and partly it's because we have different priorities. Because I'm a historian, one of the things I'm very interested in is how an epidemic is not just about disease. It's true that it starts off because of a pathogen, and we're responding partly to the movement of that pathogen. But pathogens, of course, become epidemics because of how they react within human society. It's also about human behavior, and it's also about what we think is very important, our social values and our political values. So an epidemic is not just a biological phenomenon. It's also a political phenomenon and a social phenomenon. And that's why we can see in this end process how all of these competing interests and these competing values are taking center stage. And so it's not simply about rates of disease, it's also about what people think is most important to them. And so I think in that sense, we can see very much so that England is in this messy process of debating and very often disagreeing about what's important. But of course, in many ways, that's what a society does. It has different ideas and different values. And so part of what we're trying to do now is to articulate those values and to come to some sort of negotiated agreement.
So you're on this multidisciplinary team that's looking at this. I imagine it's almost like like the Avengers of pandemics that are like assembled together to try and figure out how these things end. What kind of conversations are you guys having, and what kind of debates are you finding that you didn't necessarily expect?
I think what's interesting when you bring together so many people, there's about 30 to 40 researchers on the project, and especially from different disciplines, is that you realize that we're not going to find one point of agreement. And in fact, in many ways, the project was designed for us to think about how different groups measure different things, different disciplines measure different things. So the mathematical modelers, for example, are looking specifically at numbers in terms of cases of disease. They're very focused on that kind of statistical analysis. And then you can see how, say, anthropologists are looking at how human communities experience disease, what happens to human relationships when there's an outbreak of disease, and also what happens after the outbreak of disease. So those are very different ways of thinking about what an epidemic is, and they're very different ways of measuring what we might think of as being the end of an epidemic. And so we all have different things that we're looking at. And so in some ways, I think that disagreement is important to understanding this process of an epidemic. If we're only looking at rates of disease, then we might not actually capture the full experience of what it's like to live through an epidemic. The other part to think about is the geographic experience, how different parts of the world are. We can think about the epidemic of HIV and AIDS. That's an epidemic that in some ways has never really ended. And people might forget that it was an outbreak of a new disease. It was very much a pandemic. It's been throughout the world. But of course, in many ways, it's a pandemic where the immediate urgency and the crisis of the disease has really declined. It's not really something that many people in what we call the global north or western parts of the world are as worried about anymore. But it actually has a very high incidence in different parts of the world. And partly because the treatment depends on accessing different kinds of health infrastructure. So that's a very good example of an epidemic that has ended in different times and in different places. And as some of the anthropologists on the project have pointed out, sometimes what that means is you can develop a medical solution, say a medical treatment or a vaccine, that means that the epidemic in some ways has ended in one part of the world. But then that means many of us forget that actually it's still very much an urgent health problem, and therefore also a social and an economic problem for other parts of the world. So an ending in one part of the world can actually create more problems for other parts of the world.
So I just can't tell my Nana, it's over, it's done.
Unfortunately not. I think one thing which people will find unsettling is one of the common responses that we see at the end of epidemics in the past is people saying this is not the end and waiting for what they call the next wave. So at the end of the 1918 influenza epidemic, actually what we see is the most common response to the end of an epidemic is waiting for the next outbreak to happen. And of course, it's only when many years later it doesn't happen, then people finally retrospectively can conclude, okay, the epidemic actually ended. Sometimes they even conclude, okay, the epidemic actually ended 100 years ago. So unfortunately, one of the problems with being a historian is you realize just how difficult it is to predict the future. But at the same time, I think we should take some reassurance in knowing that the end process is meant to be messy, and that we should also think about what that means in terms of having a lot of patience and tolerance for people who might have different understandings of the end process than we do.
This podcast was brought to you by Oxford Sparks from the University of Oxford, with music by John Lyons, and a special thanks to Erica Charters. We're on the internet at Oxford Sparks, plus we have this newfangled thing called a website, oxfordsparks.ox.ac.uk. Why don't you come and visit us sometime? I'm Emily Elias. Bye for now.